Hi, hello everyone. Welcome to Farre Series. Today's topic is sexual jurisprudence. So, yesterday we discussed about some important questions in thanatology, especially rigor mortis and liver mortis, algar mortis, and postmortem artifacts, putrefaction, and all. So, today's topic is one very important topic, that is sexual jurisprudence. So, I'm audible, guys. I'm audible and visible. Yes, fine. One very commonly asked main question is about the rape. I think in last 5 years this question asked more than 10 times. More than 10 times. The question can be like this, main question: define rape, mention 7 descriptions, explain in detail about victim examination. Or sometime the question can be asked about accused examination, or the question can be classify sexual offences, define rape, explain about victim examination. So, like this the question can be framed. Okay. So, define rape, mention 7 descriptions of rape, explain in detail about victim examination. So, 2 plus 3 plus 5. So, usually of main question 10 mark question. Okay. So, let us start with the definition of rape. Then we are going to discuss about the 7 description and briefly about the victim examination. Definition of rape. Remember, the word rape is a legal term. It is not a medical term, it is a legal term. It comes under IPC section 375 or 63 BNS, 63 Bharatiya Nyaya Samhita. If you ask me the origin of term rape, it is from a Latin word rapire. The rapire means seize. The meaning of that is carrying of woman by force. Okay. The definition wise, you need to write the definition as per 63 BNS or 375 IPC. So, what is 375 IPC? That is definition of rape. 63 BNS, it is nothing but your 375 IPC, that is going to define about rape. What constitutes rape? Okay. So, according to this, a man said to commit rape, you can see here, a man said to commit rape. Every word is important here. Every word is important, guys. A man said to commit rape if he, it is mentioned a man, okay, or not any person, it is a man. So, as per 63 BNS or 375 IPC, only a man can commit the offence. Only a man can commit the offence rape upon a woman. Okay. A man is said to commit rape if he do following act. So, what are they? So, the mnemonic is there. The mnemonic is PIMA, P-I-M-A. P for penetration, I for insertion, M for manipulation, A for application. So, the mnemonic of the definition you can remember: PIMA. P for penetration, I for insertion, M for manipulation, A for application. So, you need to describe each word, okay, penetration, insertion, manipulation and application. So, everybody just write PIMA in the chat box. PIMA in the chat box, everyone keep writing. Good evening, relay. Just write the keyword or the mnemonic PIMA in the chat box. Yes, guys. Okay. So, let's discuss about penetration. So, the penetration of penis into vagina, urethra, mouth, anus constituents rape. The here question comes is it partial penetration or it is complete penetration? Your answer should be even partial penetration or touching the labia majora can be rape. So, I'll repeat again. Rape is a legal term. It is defined under section 63 BNS. It consists of 4 keywords. Mnemonic is PIMA. So, P for penetration we discussed. Mohammed Yahya, good. I for insertion. Insertion of any object other than penis into vagina, urethra and anus. So, in exam you need to define rape like this only. It is the standard definition given in most of the textbook, also in BNS. So, definition of rape can be a 3 marks question. It can be very commonly asked Viva question as well. So, I for insertion. Manipulation of body, that is applying force just to cause penetration. Manipulation of body of victim to cause penetration can be a rape. Lastly, application of mouth into vagina, urethra and anus. This is the definition of rape. Now, here is the one question. What is the consenting age for sexual intercourse in case of female? Anybody? Rili and Muhammad Yahya. What is the consenting age? What is the consenting age as per BNS or as per 375 IPC? What is the consenting age in giving consent for sexual intercourse? Yes, anybody? Okay, Sumana De and Relay, very good, 18 years. 18 years, very good answer. Remember the word 18. The consent is valid only when age of the victim is more than 18 years. Having intercourse with female of age less than 18 years, even with the consent, can be rape. That is known as statutory rape. So, there are different types of rape. One is the statutory rape. So, statutory rape is the condition in which the victim age is less than 18 years. Try to understand this. Okay. Good. Abu Bakar, Sumana De and Relay. Good. Good answer. Okay. Now, try to answer this question, guys, for understanding, only for understanding purpose. A boy age 17 years ask his girlfriend age 16 years. So, age of the female is 16, age of the boy is 17. To have sexual intercourse, she willingly agrees. She willingly agrees. Willingly agrees. Her will is there. Later, guardian of the girl files a complaint in police station. True about above scenario, all except. So, there are 4 options are there, guys. Just go through this. Option A, boy can be arrested under 63 BNS, that is rape, or 64 BNS. or any section of BNS. Okay, 64(1). Option B, here her will to have sexual intercourse is present, but her consent is valid. Option C, will is also there, consent is invalid. The word will means ability of reasoning power of mind that determines whether to do an act or not. So there are 4 options are there, guys. Boy and a girl, age is 17 and 16, victim age is important here, that is 16. So anybody, so what would be the answer for this question? Anybody, any student can answer this? Can answer this, guys? So boy can be arrested under POCSO also. Okay, he can be arrested under POCSO, that is protection of children from sexual offences. Can also be arrested under 64(1) of BNS. So this is a true statement. Will is there, her consent is valid, that is a false statement. So false statement. I said consenting age is 18 years, here the age is 16, so will is there but consent is invalid. What is the consenting age? 18 years. Okay, so C is also true, D is also true. So there are 4 options, 3 options are correct, 1 option is incorrect. So answer is B is the correct answer. Very good. Suvankar Das answered. Suvankar Das, very good answer. And Sumana De also answered. B is the answer. Very good. Yes, guys, have understood this definition. Shall I move ahead? Yes, guys. Yes, everyone. Can I move ahead, guys? Definition you need to write properly in exam. If you want to get distinction in forensic medicine, you need to define certain definitions in exam. Like example, define drunkenness, define medical negligence, define McNaughton's rule, define rape. So there are certain legal definitions you need to mug it up. Okay. Yes, Sumana De, fine, good, very good, very good. Have you seen this movie, Section 375? There are many movies related to rape and punishment, Delhi crime and so many, right? So yes, fine. Next comes is the 7 descriptions of rape. So what are descriptions of rape? A typical 3 marks question, very typical 3 marks question. Okay. The first description, against her will. Against her will. So consider a female, okay. So it is said to be rape if it is done against her will. The will means it is the voluntary choice, reasoning power of the mind. It is whatever act that is done against her will constitutes rape. That is the first description. Second description, without her consent. Without her consent. I said consenting age is more than 18 years. Less than 18 years, it is statutory rape. But remember, every act done against the will, it is considered as without consent. But remember, an act done without the consent of a person is not necessarily against her will. So try to understand this. This can be asked in your viva. Okay. Will is not exactly is equal to consent. Both are definition. Both have different meanings in definitions of rape. Okay. Next, in the previous scenario, there was a will, but the consent also was there, but the consent was invalid. That is okay. Yes. Yes, Suvankar Das, fine. Next, with her consent. So, taking consent from the female. So, taking consent from the female or the victim under the fear of hurt or under the fear of death. Okay, so under the fear of hurt, death, or fear of hurting her relatives or anybody. So getting her consent under the fear, under the hurt, so that is also constitutes rape. So consent should be free, voluntary. Okay, free, voluntary, with a sound mind it is. Otherwise, it constitutes rape. Next, with consent. So, consent from the victim under impersonation of husband. Impersonation of husband, where the offender look like husband. Like example, identical twins, or where the act which is done in darkness. So, that is also one description. Next, with her consent under intoxication. So, getting the consent from the victim or the female under the intoxication. Can I name one date rape drug? Anybody? Can I name one date rape drug? Anyone in the class? Date rape drug? Yes, anybody? Come on, guys. Suvankar Das, Sumana Dei. Date rape drug. Can I name one drug? Yes. So one is flunitrozepam, rohyphenol. Okay. So that's one example for that. Okay. Then the sixth definition or the sixth description, less than 18 years of age. Last one, when victim is very good, Sumana De, and when victim is unable to communicate the consent, when she is deaf and dumb. So also it is a description. So I'll repeat again, there are 7 descriptions of rape. One is against her will, against her voluntary choice. Second, without her consent. With her consent, with the fear of death or hurt. With consent under impersonation of husband. With consent under intoxication. Like example, date rape drug or alcohol, anything that is. Less than 18 years of age. Unable to communicate the consent. So these are 7 descriptions you need to write in the exam. So will is not always the consent. Okay. So they are both are different terminologies. GHB, very good, Suvankar Das. One more example is GHB, very good. Gamma hydroxy butyrate. Excellent answer from Suvankar Das. He answered GHB is also one date rape drug. Very good. So shall I move ahead, guys? Have understood this? Have understood? Everyone? If you have any doubt, you can ask me. Okay. Now, next heading, what is the medico-legal report? So, now next is the victim examination. So, victim examination is also very important in your practicals. It can be 10-mark question in your theory. It can be 10-mark question in your practical as well. So, we discussed in PW classes, so about the victim examination in detail around 45 to 1 hour lecture. So, medico-legal report on alleged victim. So, the better word is survivor of sexual assault. So, what are the components and what you need to write in the exam? Fine, Sumana De. So, it comes under 184 BNSS. Point number 1, 184 BNSS. Okay. So, Bharatiya Nagarika Suraksha Samhita. So, 184 BNSS, that is related to victim examination or survivor of sexual assault. So, what should be done? how to collect these samples, what are the evidence to be collected. All this comes under 184 BNSS. So we discussed today two important sections: 63 BNS definition of rape, 184 BNSS Nagarika Suraksha Samhita, that is your victim examination. Previously it was 164 CRPC, now it is 184 BNSS. So all of you just write one word 184 BNSS in the chat box. 184, keep writing, keep interacting with me. So now how to write medical legal report and what are the important points? Let's start with the one by one. The first thing you need to write about the general particulars. What is the name, what is the age, sex, and all these details you need to write. So that comes under general particulars. But remember, never reveal this identity of victim to media or any person, because it is a punishable offense under 72 BNS. 72 BNS. Okay, revealing identity of the victim is punishable under 72 BNS. The punishment can be 2 years of imprisonment. Then, any case of rape, it is your duty. It is your duty to inform the police station. Inform police. Okay, inform police. Then also never reveal the identity to any unauthorized person. Okay, so this is the first point. Next, informed consent. So when you are doing medical examination, medical legal examination, what is important is consent. The consent is very important even in examination of victim of rape. So informed consent, you need to explain about the importance of examination. You need to do counseling also before that. So that is known as informed consent. Okay, this is the medical legal report. It can help in the administration of justice. Sometimes it can go against her or him also. That is what informed consent. Or sometime when they are not willing to give consent, you need to record informed refusal. Anybody, what is the consenting age for medical legal examination? What is the consenting age for medical legal examination in case of victim of rape? Anybody? Age. That means at what particular age or above what particular age the victim can give consent for examination? Anybody? Sumana De, Suvankar Das. Suvankar Das, anybody guys? Anybody can answer this. What is the consenting age, guys? Yes. Is it 18 year, 14 year, 16 year, 18 year? What is that? No, relay, it is not 18. For medical legal examination, remember it is more than 12. It is more than 12. So any girl of more than age 12 can give consent for medico legal examination. When age less than 12 year, you need to take the consent from the guardian, which is known as loco parentis. Okay, this is the point you need to highlight it. So informed consent for examination or informed refusal also, that also you can document. So this is what the second point. Then identification mark, at least 2 identification mark. So as you know, identification very important in court of law. So you need to record 2 identification mark, either birthmark, a scar mark, mole. So you can record it, 2 identification mark. Then presenting complaints. So what are the presenting complaints? Presenting complaints can be bleeding, can be pain, can be multiple injuries. So presenting complaints you can write. Then history. So history of the incident that you need to write briefly in the medical legal report. Then it comes is the examination. Examination can be general examination, local examination, injury examination. Everything should be proper and should be complete. So what are the findings in case of rape? So usually there can be hymen tear. So Genital injuries can be present. When genital injuries are there, that shows that so there is a application of the force. I know. Yes. Okay. Yes. So anybody, what is the common position of hymen tear? What is the common position of hymen tear? Anybody can answer this? Anyone, guys? Anyone? Anyone? What is the common position of hymen tear? Yes, hymen tear. So your options are like anterior, posterior, posterolateral, anterolateral. What is the common position? Common position is, yes, relay, Sumana De, Suvankar Das. You can interact with me during YouTube live lectures. So what is the use of live lecture? Interaction. Otherwise, everything is there in the recorded lecture. Hai na? So yes, come on guys. So your answer should be posterolateral. Okay, posterolateral. Posterolateral is the common site. And remember, yes, 5 to 7 o'clock position. Very good, Sumana De. So, and remember, two finger test that is not done during rape victim examination. So, instead of that, you can use an instrument known as Gleister Keen rod, GK rod. Okay, GK rod. So, this can be asked in your exam. Gleister Keen rod is used in documentation of hymen tear. The common site is the posterolateral. And to look for micro injuries over the genital area, hymen, labia majora, minora, and all, you can use toluidine blue as well. Toluidine blue, which is the agent that is used when micro injuries are there. When there are exposed DNA, RNA, it is going to bind with the DNA, RNA. It is going to stain it. So micro injuries we use toluidine blue. Okay, good. Then the investigation. So you can do investigations. Okay, blood investigations or any infections, HIV and sexually transmitted infections. You can do investigations. You can also give a treatment. Okay, treatment that is a contraception. One important. You need to take the X-ray of the genital area, pelvic area. So to look for any fractures or injuries or bleeding, all investigation should be done. Then collection of the samples and also preservation of samples. That's very important, guys. So collection of evidence is very important because it is an heinous act. So to prove this crime, so we need evidence. Court usually asks evidence. So evidence should be collected as a doctor in a kit known as SAFE kit. What is the kit name? SAFE kit. That is the Sexual Assault Forensic Examination Kit. Sexual assault SAFE forensic examination kit. SAFE kit is used. Okay. Next, provisional opinion. You can give provisional opinion. So once you get all the investigations reports from the FSL and all, you can give final opinion. So final opinion can be given after receipt of all the investigation reports. Yes, yes, Yakin need fine. So this is about the examination. I discussed briefly general particulars. We discussed informed consent, identification mark, what are presenting complaints, history, general history and history of the incident, examination, general examination, genital examination, local examination, investigation, treatment we discussed, and the samples. Sample maybe samples from the injury, any seminal stain, or swab from the cervix, vagina and all. So, and provisional opinion, final opinion. Okay. So all these are the specimens should be collected: scalp hair, blood stain, seminal stain, bite mark if it is there, blood sample, any foreign material you can collect, urine, nail scraping basically for DNA. So DNA fingerprinting. Okay. So what are signs of injury? There can be injury to the head, scalp, black eye, because of the injury to the intracranial fossa, to the forehead. So abrasion, bruises very common, bite mark, defense injury, broken fingernails, abrasion, bruise. So all these are the signs of injury. Anybody, what is the principle of DNA fingerprinting? What is the principle of DNA fingerprinting? Can anyone answer? What is the principle of DNA fingerprinting? Sumana De, Relay, everybody, Suvankar Das. Suvankar Das. What is the principle of DNA fingerprinting? Okay, here are some defensive injuries. So over the forearm. Okay, so defense injury can be active defense injury, a passive defense injury. Okay, passive defense injury. There can be surface injuries, like example graze abrasion. So there can be graze abrasion, there can be scratch abrasion, there can be bruises, so there can be lacerations depending upon the case. Lip bruising, so lip bruising is also finding in case of victim of rape. Finger tip bruising, so depending upon the case. So all these are different injuries, very important. Now anybody, what is the principle of DNA fingerprinting? I asked you about DNA fingerprinting, guys. DNA fingerprinting, what is the principle? I know it is for identification. So what is the principle of that? Not the fingerprint, guys, DNA fingerprint. It is not low-card exchange. Low-card exchange basically that is the trace evidence. That's fine. My question is very specific. DNA fingerprint, what is the principle? You know, introns, exons and all. So what is the principle? One word answer for that. One word answer. Anybody? Sumana De, Relay, Yakin, anybody? Suvankar Das. Can anyone answer this? Anyone, guys? Anyone can answer this? DNA fingerprinting. DNA. What is that? Your answer should be VNTR, guys. Very simple. VNTR. Variable number tandem repeats. Okay. So that is the VNTR. Yes. Good. So all is about the victim examination. Then you can see here safe kit. Safe kit we can see here. This is the safe kit, is also known as Vitullo evidence kit. It was first explained by Vitullo. So this is a safe kit. Okay, now let me ask you one more question, guys. One example, one hypothetical example. What is the final opinion at victim examination? So what is the final opinion of victim examination? On examination, there are abrasions are there, bruises are there over the right arm. So over the right arm, bruises are there, abrasions are there. Hymen tear is present. Laceration over the thighs present. Semen is also present. So what is the final opinion? Can anyone, can you guess? Anyone, what is the final opinion? So remember, rape is a legal term. It is decided by the court. It is decided by the judge. As a doctor, what should be your final opinion when these injuries are there? You know, there are some injuries over the body that shows that there is a force, and there is a genital injuries, so there is a forceful penetration, and semen is also present, that is suggestive of sexual intercourse. So what would be the final opinion as per your report? Anybody? Anyone, guys? Anyone? Can you answer this? Can you answer this? Okay, semen is there, that means there is a sexual intercourse. Okay, there is a sexual intercourse for sure. Sexual intercourse. So, and also there are injuries are there. So, force. So there is a forceful penetration. Okay, forceful penetration. So, your answer should be, it is, there are signs suggestive of forceful vaginal or anal intercourse. You can see genital injuries are there, physical injuries are there, semen is also present. That means this is the report. Okay, very good, green shot, very good, green shot. He answered correctly. There are signs suggestive of forceful vaginal intercourse. This should be your final opinion. Okay, so we discussed in detail about this opinion in our classes, especially in recorded lectures. You can go through that. Okay, that completes your main question. Now there are some MCQ, guys. There are some MCQs. So prof exam MCQs. Try this questions, guys. Try this for better understanding. The question number 1, I am going to read the question and the options. You need to answer. So one who answered correctly, I am going to write the name of the student over the slide. Ready, all of you? The question number 1, a 24-year-old man gets married with 16-year-old female. So definitely it is illegal. It is a illegal one, because the marriage age is 18 years. But here 16 year. Having sex with her will be considered rape if case is filed within 1 year of marriage. 1 year of marriage, because no consent taken from wife. Option B, wife age less than 18 year. Option C, wife age less than 21 year. Option D, wife age less than 17 year. So what would be the correct answer, guys? Yes, come on, guys, come on. What is the correct answer? So okay, so here husband and wife, 24, 16, 1 year of marriage. So it is not A, not D, it is not C. I said 18. So wife, so it is 18, other females also 18. So B is the correct answer. Very good. The first to answer is Sumana De. Very good. Sumana De is first to answer this question. Good answer. Good. Relay also answered. Very good. Fine, that is. Now second MCQ. Husband had intercourse with a wife during judicial separation. So during judicial separation, when there is a case pending between husband and wife, that is the divorce case, without the consent, the section which deals with it. Okay, options are 63, 66, 67, 68, BNS, Bharatiya Nyaya Samhita. Anybody, can you guess, guys? Anybody, can you guess? Yes, 63 basically definition of rape. Definition of rape. 66 rape and murder. Rape and murder are persistent vegetative state. Okay, 68 it is sexual intercourse by authority. Sexual intercourse by authority. So answer is 67, BNS is the correct answer. Very good. So this is the correct answer. So the answer given by, so green shot, Relay, Sumana De. Okay, many answered. Okay, C who answered, again Sumana De answered, and green answered B. That is fine. So answer is C, guys. Very good. Following is used to document tear of hymen in victim of rape: vaginal speculum, Gleister keen rod, cylinder rod, Hagar's rod. So very simple, guys. Already we discussed about it. Yes, come on, guys, come on. Yes, very good. Already we discussed GK rod. GK rod. GK rod. Question number 4. Most common position of hymen tear. We discussed already posterolateral. Posterolateral. Statutory rape. What is statutory rape? That is rape of girl of age less than 18 years. 18 years is the answer. So yes, that completes your main question. Main question. Let me revise again. So this is the question asked in your exam. Main question, guys. So what is the question asked? Define rape. mention 7 descriptions, explain in detail about victim examination. So, you need to write the proper definition as per 63 BNS. PIMA is the mnemonic. There are 7 descriptions are there: against her will, against her consent, with consent with the fear, with consent with impersonation and all. 7 description. Finally, victim examination. Victim examination, you need to write about the 10 points along with the some points about the opinion. So, all of you have understood this main question. Shall I move ahead? Everyone understood? Okay. Yes or no? Say yes or no, everybody. Relay, Sumana De, understood? Fine. Now discussing one more important question, that is about the MTP Act. Okay, MTP Act. This is the question asked in your prof exam. Describe new MTP Act. So very important question in your prof exam. Medical termination of pregnancy. What are the indications of MTP? What are the guidelines of MTP? So, what is the difference between old MTP Act, new MTP Act 2021? Very commonly asked Viva question. So, what is MTP? Medical termination of pregnancy. Medical termination of pregnancy. Her body, her choice. So, that is the slogan of this act, MTP Act. Her body, her choice. Yes. Now, in this, what you must know, indications. So, what are the indications? Point number 1. What are the common rules? The common rules applicable to doctors. So, that is very important. Indication with example and the rules. Some points about the rules. Yes, fine. Now, first we are talking about the medical termination of pregnancy. It is the original rule known as 1971 rule. It is amended many times, amended in 2002, 2021 recently, and it was basically for protection and preservation of lives of women, especially pregnant women. So, it came into force in 1972 1st April, so long back. Anybody, new MTP Act, is it applicable to married female or unmarried female? Anybody? Married female or unmarried female or both? New MTP Act 2021, the correctly known as MTP Amendment Act. Can anyone answer? Is it applicable to married or unmarried, or it is both? That is what the question from me. Married, unmarried, both. Previously, it was only married. The original act, no, that was only for married female. Now it is married, unmarried, both. This is the one basic difference try to understand. Okay, yes. Now let's start with the indication. Very good. Relay answered, very good, and also Sumana, they also answered, very good. Relay answered, and Sumana, they also answered, very good. Okay, good. So, what are the indications? There are 4 indications. What are the 4 indications? The first one, therapeutic indication, eugenic indication, humanitarian indication, and lastly, socio-economic indication. What are the indications? Therapeutic, eugenic, socio-economic indication, lastly, humanitarian indication. There are 4 indications are there. So, now therapeutic indication. When there is a therapeutic indication, like example, when there is a serious threat to health of the mother, when there is an imminent danger of the pregnant mother, then you can legally do MTP. Okay. So, therapeutic basically related to maternal health or maternal health danger, maternal health. Can you give an example, guys? Can you give an example? Example for therapeutic indication. Anybody? Relay Sumana De. Sumana De relay. What is one indication for therapeutic? Therapeutic when there is a risk to maternal life. Maternal life. When there is a question of life of the pregnant woman, you can do MTP. Can you give an example, guys? Can you give one condition where you can do MTP in a pregnant woman, which is a therapeutic indication? Anybody? Anybody? So one example is malignant hypertension. Okay, malignant hypertension. When mother is suffering from malignant hypertension, so because of the pregnancy and the delivery, there can be changes in BP. Malignant hypertension, when a serious damage is there, or when the mother is suffering from some cardiac disease, grade 3, grade 4 cardiac disease, like example, very severe mitral stenosis. So abnormal fetus is a therapy, it is a eugenic indication. Okay, eugenic. Yes, eugenic, as Relay said, eugenic basically fetal indications. Okay, fetal indications when there is a fetal abnormalities, like example, anencephaly because of deficiency of folic acid, neural tube defects, or severe anomalies. There are many examples. Or when fetus exposed to some teratogenic drugs, fetus exposed to radiation more than 5 rats. So in all this condition you can do MTP, that is known as eugenic. Then comes is the socio-economic. Can you give an example, guys? Socio-economic indication. Anybody? Socio-economic indication. Okay, anybody? What is the socio-economic indication? One of the, in fact, it is the most common indication. The most common indication of MTP Act. Relay Sumana De, Suankar Das. Anybody? Socio-economic. Okay. So your answer should be contraceptive failure. Very good. Contraceptive failure. So contraceptive failure, accidental pregnancies, so that cause socio-economic burden on the family. So contraceptive failure, so that is okay. Humanitarian, because of the rape, pregnancy due to rape, or pregnancy due to incest. Okay, so all these are examples for humanitarian. So I'll repeat again, there are 4 indications, guys: therapeutic, eugenic, socio-economic, and last one is humanitarian. 4 indications are there. The most common indication that is your contraceptive failure. Okay, good, Sumana De, good answer. Fine. Now here is the list of therapeutic indication, like cardiac disease, chronic glomerulonephritis, intractable hyperemesis gravidarum, malignant hypertension, epilepsy, insanity, cervical breast cancer, diabetes mellitus with retinopathy, toxemia pregnancy. There are many indications, guys. So there are list of indication under therapeutic indication. Okay, yes. Okay, have you understood this examples, guys? Have understood all these indications? Okay, next, eugenic indication. Eugenic, already discussed, radiation exposure more than 10 rats, exposed to teratogenic drugs like warfarin, anencephaly, Down syndrome, so inheritable mental retardation, chromosomal abnormalities, all these are eugenic indication. Then I discussed about socio-economic, unplanned pregnancy with the low socioeconomic status, failure of contraceptive, okay, failure of OC pills, okay, or barrier methods. So every method has some failure. So failure of contraceptive can be socioeconomic indication. And the last one I said about humanitarian, that is because of the rape. Okay, rape. Yes, have you understood all the four indication? Shall I move ahead? Everybody? Come on, guys. Relay, Sumana De, Swankar Das. Now we're discussing some important changes in the Act. Important changes. Before that, say yes or no in the chat box. Yes or no in the chat box. Come on, guys. Come on. Her body, her choice. That is the MTP Act. Her body, her choice. Relay. Yes, sir. Fine. Chalo. Her body, her choice. Okay. Just say yes or no, everybody. Okay. Next is the rules. So, what are the rules of MTP Act? Okay. So, let's go one by one. Up to 12 weeks or say up to 20 weeks. This is very important, guys. Try to understand. Up to 20 weeks. Previously, it was up to 12, then 12 to 20. Now, it is simple. Up to 20 weeks. So, up to 20 weeks. Up to 20 weeks. Up to 20 weeks. It is 1 RMP sufficient. So, one doctor, one registered medical practitioner can conduct MTP in a government hospital or government recognized private hospital up to 20 weeks, 1 RMP. Then 20 to 24 weeks, 20 to 24 weeks. So, remember here 20 to 24 weeks, there are some other indication. So, not the contraceptive failure. What are they? When pregnancy caused by rape, when pregnancy caused by incest. Incest means having intercourse between marriage relatives or blood relatives, basically between brothers and sisters, cousins and all. That is known as incest. Or pregnancy in a minor, pregnancy in a disabled woman. In all these conditions, between 20-24 weeks, 2 RMP opinion required. How many RMP opinion required? 2 RMP. So, you need to take the opinion from 2 RMP. Then the 2 RMP, they can decide whether there is a need of MTP or not. That is up to 24 weeks. Beyond 24 weeks. So, as per MTP Amendment Act 2021, MTP can be done beyond 24 weeks also. Anybody? What is the indication for that? What is the one very important indication for MTP beyond 24 weeks? Anybody in the chat box? Anybody? Any one student? Anyone can answer this? Anyone can you answer this? Yes, come on. Disabled mentally ill child. I discussed already. Disabled mentally ill child comes under up to 20 weeks only, 24 weeks only. 24, not beyond. 24 means almost 6 months pregnancy here. So, some usually 7 months is viability. So, viable child, doing MTP, it is not that safe also. So, disabled mentally ill child relay, it is comes under 24 weeks. My question is 24. Okay, mentally ill child. Achha. So, okay, fetal abnormalities, basically fetal abnormalities. So, fetal abnormalities or fetal anomalies. Fetal anomalies. So, this is decided by medical board. Okay, not by simple RMP, by a medical board. So, medical board that consists of a gynecologist, a pediatrician, social worker, radiologist and all. So, whether MTP needed or not needed decided by medical board. So, the one indication is fetal anomalies. So, I will repeat again, up to 20 weeks 1 RMP, 20-24 2 RMP, Beyond 24, medical board opinion is required. Okay, good. So now in emergency, what to do? Say example emergency. Some emergency is there. Say some emergency, maybe 28 weeks or 24 weeks or 20 weeks. Some emergency is there. Emergency to the mother's health. If continuation of pregnancy going to affect the mother's health, there can be imminent danger to mother and the fetus. What to do? Can you do MTP at any time, at any place? Anybody in emergency? Consider a rural hospital where there is only one doctor, only one RMP is there. So can you conduct MTP there? In emergency, I'm telling you, when the word emergency comes, yes, anybody in emergency? In emergency, MTP can be done at any place by any RMP. Try to understand this. Any RMP, 1 or 2 or any RMP, at any place, So try to understand this. That's why MTP is a liberal act, very liberal act. So here what is needed is the qualification. So in emergency, in any RMP can do at any place. Okay, that is the okay. Then last one, breach of women privacy. This is the one new terminology. Breach of women privacy. You need to keep everything, details of the abortion, details of the MTP in secret. Never share with anybody without the consent of the mother. Otherwise, it is a punishable offence. The punishment can be 1 year of imprisonment. 1 year of imprisonment and 1000 rupees fine. So this is try to understand, guys. I'll repeat again briefly about MTP rules. Up to 21 RMP, beyond 2024 2 RMP, more than 24 medical board I discussed. In emergency at any place by any RMP. So breach of women privacy, it's a punishable offence of 1 year imprisonment and 1000 rupees fine. Anybody, what about the consent? What is the consenting age and whose consent is required? Anybody? Relay, Sumana, they, everybody. What is the consenting age, guys? What is the consenting age for MTP? And whose consent is mandatory or whose consent is needed for MTP? Anybody? Is it a mother, a father or boyfriend? Whose consent is needed for MTP? Are both husband and wife? Are only girlfriend? No need of consent from the boyfriend? Whose consent is needed for MTP, guys? Tell me. Yes, mothers, very good. Relay answered, sir, only mother consent is sufficient. For MTP, only mother's consent is sufficient. Or the pregnant mother consent or the girl consent is sufficient, not the husband. Okay, consenting age is 18 years. Again, 18 years. 18 years. So this is about the MTP Act rules. You can also write about criminal abortion in exam. So that can be a 3 marks question. Okay, criminal abortion. So this completes your MTP rules. Okay, all of you guys have understood new MTP Act 5 marks question. You need to write about the indications. You need to write about the important rules only. There are list of rules. Don't worry about that. If you write some 5-6 lines with a proper answer, that is fine. So all of you understood this new MTP Act. Any doubt in this? Relay, Sumana, they, everybody. If you have any doubt, you can ask me. And also try to remember criminal abortion. Criminal abortion is punishable under 88 to 90 BNS. 90 BNS. This can be MCQ, guys. So criminal abortion punishable under which BNS? So previously it was 312, 313, 314 IPC. Now it is 88 BNS, 89 BNS and 90 BNS. 90 BNS. So this can be an MCQ in your exam. So 88 BNS, criminal abortion with the consent of the mother. 89 BNS, criminal abortion without the consent of the mother. 90 BNS, so when there is a death of the female due to complications of criminal abortion, that is 90 BNS, punishment can be life imprisonment as well. So 89, 90 and 88 you need to remember. So this completes your new MTP Act. This is how you should write the answer in your exam. Okay, forensic medicine is like a mathematics. You need to write proper answer. For every question you can write medico-legal importance. Like arsenic poisoning, you can write medico-legal importance. Copper poisoning, you can write medico-legal significance. Or rigor mortis, you can write medico-legal importance. What is important is medico-legal importance, not the other theory part. Important is MLI, medico-legal importance. Yes, so this completes your sexual jurisprudence. Any doubt, guys? Any doubt you can ask me. So we have some more sessions like medical jurisprudence, like medical negligence. We have some sessions about toxicology. Toxicology around 25 marks in your exam. So one session about toxicology and one more session about the forensic practicals. How usually they are going to conduct the forensic practicals. So what you need to study, not to study, and all we discussing in upcoming classes. Yes, okay, relay and others. Okay, that's it about the today's Farre series. Yes, thank you all. Okay, relay. Okay, thank you. Let's conduct some more classes like this in upcoming days. So, just a samples of classes, Farre series. It's very vast. So, forensic medicine is very vast. So, there are recent updates in forensic medicine, and it's a very interesting subject. One subject which is very important in court of law and also in judiciary system is forensic medicine. You must know very well. Yes. So, what is marital rape? We discussed already marital rape. So there is no definition of marital rape in IPC or BNS. So there are some sections we discussed in the beginning of the class. Okay. Sukhbir Singh we discussed already. Okay. So that's it about the today's class. Thank you all. So meet you in some other class. Thank you.